Hi, I'm Don Berwick. I'm President Emeritus and Senior Fellow at the Institute for Healthcare Improvement here in Cambridge, Massachusetts. I'm also former administrator of the Centers for Medicare and Medicaid Services, and I'm delighted to help celebrate the 50th anniversary of Medicare and Medicaid. As administrator, I got to see the enormous power and potential of leadership for the benefit of the public in the arena of healthcare. Every day that I went to work, I got to think about the well-being of 100 million Americans in Medicare and Medicaid, people who, because those programs exist, have coverage they otherwise would not have. I also got to fight for their rights and their benefits. I got to fight for the quality of their care. We had transparency so that I knew how the care was going, and I could spot areas where we really needed to invest further using the tools of public policy to help make things better for patients and families. It's the best job in American healthcare. I think this country should celebrate the enormous, majestic step it took in the setting up of Medicare and Medicaid, and frankly celebrate also the progress of the Affordable Care Act. As controversial as it is, think about it. If that act is successfully implemented, 30 million more people will have benefits from the benefit of coverage from healthcare, so they won't have to wake up in the middle of the night worried about going into bankruptcy. They'll also have a government at their side fighting for better and better care. Where now? Look, I think there are two premises. Premise one is healthcare is a human right. Every Western democracy has made that declaration. Ours should also. Americans should have access to care, period, as a human right. The advances that were made in Medicare and Medicaid can be brought to the benefit of everyone in this nation if we would commit to that fundamental principle, Medicare for all. And the second principle is that healthcare can and should be much better than it is. We know from the guidance of our National Academy of Sciences that better care is possible, feasible, and not yet in our hands. Care that's safe, effective, patient-centered, timely, efficient, equitable. Care that meets the demands of the triple aim, the social need for health care, better health, and lower cost. Medicare and Medicaid can lead, have led, in pursuit of that triple aim, in pursuit of that better care. I got to work on that as administrator, and we can bring those benefits to all Americans if we commit to the kind of healthcare system we want and need. The way there is not through exhortation or demands, it's through redesign, constant redesign, using the imagination of America to reinvent the care system that really will meet our needs, where we need care, when we need the care, how we need the care. We can do that. The leadership of Medicare and Medicaid in pursuit of better care and universal care for everyone has been unparalleled in this nation. We need to bring those benefits, universality, health care as a human right, and continual improvement of quality to absolutely everyone. That's the pursuit I've been engaged in my career and will continue, as I know you will.